With me now is Nisa Ernst, nurse manager of the Johns Hopkins University Biocontainment Unit. We just went through the numbers. It's a dire situation around the world and could get worse here in the U.S. as people ignore the advice of public health officials and travel for Thanksgiving. How are hospitals preparing for a surge in holiday cases?
We are right back into Surge 2.0 planning. I'm currently up on the biocontainment unit where we're training our next round of safety officers. Most of the hospital has opened their departmental and hospital-wide incident command centers, and we are right back to that, down to the last detail to get units opened, units staffed safely, and patients taken care of.
I'm seeing reports from around the country right now that we're back to the situation we were in March and April when hospitals were using extra rooms and hallways to treat patients. Are we there yet at Johns Hopkins University?
No, we're not there yet at Johns Hopkins. And part of the reason is we did a lot of lessons learned from the last surge. So we have actually reopened some old units that were essentially decommissioned. We opened a 23-bed medicine unit almost overnight to be able to manage both the non-COVID and the COVID inpatient demand.
Nisa, one thing that has been so heartbreaking about this pandemic has been the fact that people cannot see their loved ones when they're in the hospital. The images of descriptions of people FaceTiming with loved ones for the last time before they pass away from the pandemic are absolutely heartbreaking. You've mentioned state mandates about family visits to patients. So how are nurses getting creative to let families connect with one another during these times?
So nurses are doing a lot of different techniques. We're combining some technology with good old-fashioned common sense. We have a lot of systems that we may not have used in the past. For instance, we have a system where if your family member is in surgery, give us your cell phone number, and as the computer changes the different phases of care, you're alerted at each part. My son actually had to go into the emergency room the other night, of course, no visitors, and the nurse said, here is a cell phone number to contact me if you have any questions. I felt as if he was very well taken care of. Some of the other things that we're doing, we had a family member who, of course, couldn't have any visitors. We had their children draw some pictures, email them to me. I printed them out and posted them in the patient's room. Those are the types of things we are doing to keep our patients' morale up as well as our own. It is very difficult for a nurse to not have a patient's loved ones with them at any point in care.
How does this translate into recovery? I know that obviously when it comes to recovery and success, we look at data, but give me a holistic view of how important it is to have family support in a patient's journey.
Sure. Well, it's important for both the patient and the staff. The family members are really good. They know these patients much better than any provider that's met them in the emergency room or on the inpatient unit. I used to say that all the time as an inpatient nurse. Tell me about this person. You know them. What do they like? What do they need? How can I better take care of them? Families are integral in the plan of care and in improving patient outcomes. And that's why, again, we have to be very creative at this point in time to be able to maintain those high outcomes and maintain the patient's, again, the moral resilience. This is very, very difficult for all of us.
You and your colleagues have been on the front lines since March, dealing with patients and helping make people better. What is the toll that it's taking on you and your colleagues, and what can be done to help them get through this?
It's a great toll. There's a lot of what we refer to as COVID fatigue. You know, we're tired. We're tired of having to mask up. We're tired of having to follow all these restrictions. And now we're not able to see our families around the holiday. So a lot of what we do here at Johns Hopkins is really to build that moral resistance muscle. Like, let's get some moral resilience and let's learn some techniques up front. Some of which is, for instance, we have very specific built-in breaks on the COVID units. When nurses are caring for COVID patients, it is very specific that they take a break at a particular time, get out of all their PPE, sit down and relax, and then go back refreshed to take care of that patient.
What's the message that you have for people watching right now who may be on the fence about visiting family over the holidays?
I will tell you my own story. I have an 87-year-old father-in-law and an 89-year-old mother. We are not going to see either of them this holiday. We're going to set up a Zoom. This is the year that all of us need to change behavior so that we can save lives.
We got some encouraging news overnight from the Oxford AstraZeneca study, Oxford University, that's telling us that this is effective. Their vaccine, is effective in older patients. What does that tell you about the timeline, given that these older patients are the ones who are likely to be able to get the vaccine earlier?
My timeline would be to have this in my hand today and be able to administer it. But that's not necessarily a reality in order for this to be safe. I am so very encouraged by the way manufacturers have gotten together and risen to this call, because the vaccine is really going to make a difference. Behavior is very important. Vaccines are not going to change things overnight, but please, if you have the opportunity to participate in a clinical trial or be able to get the vaccine yourself, please do not be afraid. Please step up. I myself am looking to get the vaccine as soon as I possibly can, because that's my commitment to you as a healthcare provider.
How do healthcare providers get the message out to Americans and people around the world that the vaccine is the right way to do this? I mean, there's so much skepticism around what we hear from government officials right now, that one concern I have, and I know public health officials have, is that people are not going to take the vaccine because of safety concerns they might have.
We need to do a lot of work with our community partners. We need to look for our community leaders, do some very good, robust education question and answer sessions, and model vaccine compliance ourselves. And get the message to the community that this is not something to be afraid of. Again, once it's cleared all the right scientific trials. But this is very important to get this message down to your beautician, to the person that you're next to in church, really to get what is going to help us not have to relive 2020 is when the vaccine is safe and available, is as many of us as possible to step up. My sister lives in New York City. She told me a story of SARS and how everybody was a little resistant in the very beginning for the vaccine. And then there were lines 2 hours long in all neighborhoods around New York because people said this is the right thing to do. And it's time for us to look at that the same way.
Johns Hopkins University nursing manager Nisa Ernst, thanks so much for your time this morning. We appreciate it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.